This is our proposal for a biomimetic surgical adhesive to mitigate post-operative leaks following pulmonary resection. This is a proposal for the American Lung Association.
Picture yourself coughing. With the current changing weather and people getting sick because of it, this is not uncommon. Now, imagine constantly coughing, something that does not go away. You start feeling a pressure on your chest, which leads to constant chest pain. This is how a person with post-operative air leaks in their lungs feels, which is something that more than 58% of patients who undergo closure methods, such as sutures and staples, experience. The estimated cost if these air leaks are not fixed can be up to $40,000, representing an extremely high financial burden for these patients. Surgical tissue adhesives have been used to prevent these air leaks, among other reasons, such as reducing operation time, reducing tissue handling, and mitigating infections. However, the current tissue adhesives in the market do not present a high adhesion strength on wet surfaces, such as soft tissue, and have been shown to have high cytotoxicity.
We designed a biomimetic surgical adhesive with two goals in mind. The first, to target the wet environment, such as the squamous epithelial cells that are found in the lungs, and the second, to incorporate antibacterial properties. We included a variety of biomimetic features, such as adhesive granules. Two types are heterogeneous, including PC3B, PC1, and PC4, as well as catechol oxide, and homogeneous granules, such as sulfate polysaccharides, PC2, PC5, as well as catechol oxidase. When they interact post-translationally, they undergo masturbation and cross-link to catechol oxidase to increase the adhesive strength of various materials. The use of these proteins is inspired by the sandcastle worm, which secretes these proteins to build their roots. To achieve our second goal of integrating antibacterial properties into our adhesives, we want to use antibacterial nanoparticles, specifically chitosan nanoparticles. This will inhibit the growth of gram-negative and gram-positive bacteria. Having the nanoparticles on the surface of the adhesive is also a biomimetic feature, as its nanotopography enhances adhesion by increasing contact area in capillary forces. This adhesive can be introduced using an injection to target air leaks in the parenchyma or bronchial stump of the lungs, and is a minimally invasive procedure.
Our novel surgical adhesive will have a number of benefits. First, the biomimetic design will increase wet adhesion by utilizing the synthetic protein granules similar to the sandcastle worms, which can adhere sand grains together underwater. Additionally, our design will significantly reduce post-operative air leaks compared to conventional sutures and staples, as well as reduce pain by 15% compared to these conventional methods. Because our adhesive will be injected onto the site of the leak, tissue damage will be reduced, thereby reducing pain. Our adhesive also reduces the time spent in surgery, as the sandcastle worm adhesive proteins set in 20 to 30 seconds. Another benefit of our design is that our choice of marine sponge collagen that is used as the base of the adhesive leads to a 30% yield, which is a higher yield compared to other marine species. An improved collagen yield is more efficient for manufacturing purposes. Finally, compared to commonly used bovine and porcine collagen-based adhesives, our marine sponge collagen has reduced zoonotic disease potential and reduced religious implications, allowing our design to be expanded to a broader patient population. While there are many benefits, there may be some costs associated with the device. First, the process to make the adhesive is complex. Due to the insolubility and mineralization in some sea sponges, the collagen extraction can be difficult. To effectively extract the collagen from the sponges, hazardous chemicals are used as well. Additionally, this process can be expensive and time-consuming. There are variations in the types and properties of collagen obtained from the marine sponges as well, which could lead to some variability in the design. From one marine sponge collagen, sponge-like collagen, intercellular collagen, and insoluble collagen can be isolated, and these collagens have different properties associated with them. Finally, natural proteins can be expensive to source and process, and our marine sponge collagen is a natural protein.
Zephyr valve system by Pulmonary is a major competitor to our project and is a one-way valve that can be implanted into the lung to allow for the outflow of air from the lungs, but prevent the influx of air into the lungs. These endobronchial valves are attractive to surgeons because of their minimally invasive delivery. However, one major limitation is that they can actually increase the risk of air leaks that result in pneumothorax. Commercially available surgical adhesives are another major competitor. Progel from BD is a natural surgical adhesive with albumin as its main component and is a major competitor as it's the only sealant approved by the FDA to treat air leaks. However, limitations of albumin-based adhesives include that they're too rigid to mimic lung tissue, they're cytotoxic, and they have a history of infection. Other natural surgical adhesives on the market include fibrin-based Ticell from Baxter Healthcare Corporation and collagen-based FlowSeal, also from Baxter Healthcare Corporation. Additionally, other synthetic surgical adhesives include polycyanoacrylate-based Dermabond from Johnson & Johnson and PEG-based Duracell by Integra. Finally, the various ideas presented by academic research are also all competitors to our project. Several researchers have proposed the idea of biomimetic adhesives that use muscle or snail proteins to inspire a mechanism for attachment onto wet surfaces. Our project proposes the use of a sea sponge collagen as a natural adhesive that will not elicit an inflammatory response by the body, while also utilizing the sandcastle worm proteins to enable the adhesion onto wet surfaces and prevent the reopening of air leaks into the lungs. Thank you.